Hi, hello, good day, everyone. I am Otiotion Officer Joy, and I will be discussing breast cancer awareness and early detection. Breast cancer remain one of the most leading cancer among women, affecting every young lady and elderly lady worldwide, and it is also the leading disease among Filipino women. Although it is a serious disease, but many can be prevented through early detection, through screening, through healthy lifestyles, through increased awareness, just like we're doing now, and through regular screening. In this presentation, I will be discussing about breast cancer, its risk factor, the strategy for preventing this, and also the screening recommendation. And it is important to know the nurse's role in preventing and promoting breast healthy lifestyle and reducing the burden of breast cancer. So follow me as we go through these slides. So by the end of this presentation, we should be able to define breast cancer. We should be able to understand the impact globally and in the Philippines. So we will also define both the modifiable and non-modifiable risk factor. We also discuss the different level of prevention. We also review current screening recommendation and also understand the vital roles of nurses in promoting breast cancer prevention and also early detection. So let's all first understand what breast cancer is, then and why it is considered a major public health concern. So let's go through the overview and the epidemiology. So what is breast cancer? Breast cancer is a disease which an abnormal cell within the breast grow uncontrollable and form malignant tumors. So most breast cancer begins in the milk duct or the loops, and if left untreated, these cancer cells may invade nearby tissues and spread through the lymphatic system or the bloodstream. So to the other part of the body as well. So a process known as metastasis. So approximately 2.3 million women were diagnosed with breast cancer worldwide in 2002. And also in the Philippines, breast cancer is also the leading cancer affecting women, and the statistics highlight the importance of awareness and early detection. Now let's discuss about the risk factor. You say the risk factor is always divided into two. We have the modifiable and non-modifiable risk factors. So for the modifiable risk factor is obesity, is inactivity, less a sedentary lifestyle, a smoking, excessive alcohol intake, and unhealthy diet like a fatty food. So, but for the non-modifiable factor, these are factors that we cannot change, like our gene. This like the history, like being a female, like the BRCA1 and BRCA2 gene mutation, and if you have a previous breast cancer, this can lead to breast cancer. So while factors influences risk, regular screening is important in every human. So the pathophysiology of breast cancer. From this diagram now, it shows the progression of breast cancer. The normal breast cells, it undergoes genetic mutation that causes the uncontrolled cell division. So this abnormal cell multiply to form a tumor. So as the tumor enlarges, it invades surrounding tissues and spread through the lymphatic system and into the bloodstream to the distant organ. So detecting breast cancer before its metastasis greatly improve treatment outcome. So early detection, in other words, early detection of breast cancer will help improve and patient outcome and a better health. So now let's move to the signs and symptoms of breast cancer. So these infographics illustrate the common warning signs and symptoms of breast cancer. So it is important to remember that early stage breast cancer may not cause any symptoms, which is why regular screening is so important. So the first image shows breast lump, which is around here. It shows breast lump, which is the most common symptoms. A new lump in the breast and the under the arm here should always be evaluated by the healthcare provider. So the second image presents the skin dimpling, where the skin appears pocked or resembles the texture of an orange peel. So this may indicate tumor is pulling on the surrounding tissues. So the third image here shows breast swelling, which may affect part or all of the breast, even if no lump is felt. So the fourth image here is showing nipple invasion. So this is where the nipple suddenly turn inward instead of pointing towards outside. So if this is a new change, if you check this and you feel like this is not happening before, and it's something that is really new in your body, it should be assessed promptly. So the fifth image represent the bloody nipple discharge. This is a particular concern actually, because when it occurs without squeezing the nipple, this can be a warning sign that it requires an immediate medical evaluation. So the sixth image shows redness and thickened skin, which may indicate that inflammation, or in some cases, inflammation of the breast cancer is occurring. So the final and the last image represents the persistent pain in the breast. So although the breast pain alone is not always caused by breast cancer pain, but the pain that is new, like the pain is new, persistent, or associated with other breast changes, may never be ignored. We should always check and make sure we get the healthcare providers evaluation. So, in other words, not every breast change is cancer, but any new, unusual, or persistent breast change should be evaluated by the healthcare provider or healthcare professional as early as possible. Early detection can actually save life. So then we move to the next slide, which is the breast cancer prevention. So this slide is showing three parts of the breast cancer prevention, which is the primary, the tertiary, and the primary, the secondary, and the tertiary prevention. So the first one is the primary prevention. So this primary prevention focuses on the breast cancer before it's even developed. This include adopting a healthy lifestyle, eating a balanced, rich diet in fruits and vegetables, engaging in regular exercise. It is really important to maintain healthy weight and avoiding tobacco use, limiting alcohol consumption, and also breastfeeding when possible. Breastfeeding is really important is in this breast cancer prevention. And also this healthy behavior will not only reduce the risk of breast cancer, but it will also improve overall health. So the second one is the secondary prevention, which the goal here is early detection when the breast cancer is more treatable. When a woman should practice self-awareness by becoming familiar with the normal look and then feel of their breast. They should also undergo clinical examination like mammogram, according to their ages. And they should also involve mammogram according to their ages and also individual risk. Detecting breast cancer often leads to more treatment option and better outcome. So the third one is the territory prevention, which is focuses on individual who have already developed this breast cancer. This the aim is to reduce complications, improve quality of life, and support long term. This include following prescribed treatment plan, particularly the rehabilitation and receiving emotional physical support, attending follow up regular appointment, and providing palliative care. So together, these three level or stages of prevention can extend beyond treatment, begins before and develop, continue through early detention, and remain important throughout the lifespan and health of the patient. Now, let's discuss the breast screening. So, screening is one of the most important in detecting breast cancer. So, we have different type of screening method. We have the breast self awareness, which is when it's rather than following a strict monthly routine. Women are encouraged to become more familiar with the normal appearance of their breast, to feel their breast, and it helps them recognize the unusual unusual changes or lump, skin changes, the nipple discharge, and seek medical attention promptly. So the second one is the clinical breast examination. This promotes a trained healthcare professional who will examine the breast and of any abnormal changes. This is for the examination. It depends on the woman's age, personal risk, or the healthcare provider recommendation. Another screening is the mammogram. The mammogram is an X-ray of the breast, and it remains the most effective routine screening test for women averagely. So it detects very small tumor, and it before it can actually be felt. So allowing treatment to begin at an early stage when it is most effective. Another one is the MRI, which is recommended for women at high risk, such as those with the BRCA1 and BRCA2 gene, or a strong family history of breast cancer. MRI is sensitive more than mammography. So, but it is routinely used for women at average because it is more expensive and may detect findings that are not breast cancer. So overall, this screening works together to improve the early detection, reduce mortality rates, and also provide women with the best opportunity for successful and a long-term survivor. So now let's talk about the roles of nurses and health promotion. So the roles of nurses in this is to educate the public, assess the risk factors, promote screening, counsel the patient and family, and participate in community outreach, provide emotional support, and advocate for equitable cancer care. Our message is simple: know, check, act. Know your risk, check your breast regularly, attend recommended screening, and seek medical care if you notice any changes. Early detection saves lives. So, for this, the summary of this is that most breast cancer is common among women worldwide. So, healthy lifestyle choices reduce the risk, while early detection through screening improve outcome. Nurses play an important essential role in educating the patient, prevention, advocating for the patient, and patient support. So together we can reduce the burden of breast cancer. Thank you very much for your attention, and I hope this presentation has increased your understanding of breast cancer and early detection. Together, let's continue to educate our community because early detection save lives. Early detection is the key. Thank you and have a blessed day.